governor indicated Friday she is supportive of this. She said she is inclined to support this, not to veto it, but I mean, are you gonna make any kind of direct appeal or I mean, is it too late?
Like,
Let me just get you to slide over here.
yeah, no. Like I said earlier, we are urging Governor Raimondo to stand with the medical community, with the public health community, with people in recovery, with people with lived experience to veto this bill and to just, we want to listen to us and to continue the great work she's doing around public health interventions to this overdose epidemic.
Has the current head of the Rhode Island Health Department said anything on this bill?
Dr. Alexander Scott has
Yeah.
not said anything publicly about this bill.
Have you talked to her? Or sent something to her, or you guys,
Yes.
where are you going with this? I mean, is this up for, it passed in one chamber, right?
Mm-hmm. So currently it passed in the Senate. There were 11 no votes and, like I said, about 50 minutes of fierce discussion and debate on the Senate floor. It's currently about to be heard in the House Judiciary Committee this week. We have been in touch with the Health Department and have let them know and have talked with their legislative counsel and their legal counsel about this as well, although they've not made a public statement about it.
I'd just like to add that, you know, this is a much bigger conversation that we Rhode Islanders need to have, is what are we going to do about this overdose problem? Are we going to continue to pass laws that make this more criminalized, continue to incarcerate people, continue to use that arm of our government, of our state, that power to address this problem? Or are we going to have a more balanced approach? We've already shown that a public health approach, rolling out treatment at the Department of Corrections, has saved lives. We don't have any evidence that locking up people has saved any lives. But I think we have to really look at our own addiction and our approach to it. You know, so much of this disease is about stigma. That's what the people who use drugs are all of a sudden different people. They're not one of us. They're them, those people, those bad people. And that's just not true. Those are us. We are those people. We can all become addicted. You know, the comments about this is going to hit the poor people, it's going to hit the minority people. You know, this, with existing laws, the people that are getting incarcerated are people of color. There's no question when we look at across our country, our great nation, liberty and freedom for all, not so. We incarcerate African Americans and Hispanic people at much higher rates. This is unacceptable. Is that who we want to be as a nation? No, I think we want to be treating addiction in the most effective, appropriate, smart way. And I would also point out that there are tremendous benefits to collaboration between law enforcement and public health. This particular law doesn't do that at all. This is more of the same. But the Bloomberg Initiative just came out with a series of best practices for law enforcement, and I think we should take a careful look at, and we should probably adopt all of those for law enforcement throughout Rhode Island. I think that would help. Thanks.
Thanks.
Any questions?
I do have one question for the panel, because I did hear that it was mentioned that, you know, hope is very much like a cornerstone of the narrative of the recovery community, and we recognize that recovery does work. How does a life sentence, kind of a paradigm, intersect or have an impact on the ability to send a message of hope to our communities who are struggling?
Well, I think you answered that question by asking it. That sending someone to life imprisonment it squashes hope, and it's really, you know, I think We heard that, that at a certain point, some people need to be taken out of society because they're a danger to themselves and others. And I believe that's true. But I don't think that's true for life for almost everybody. And again, I've spent the last 24 years of my life, a day a week, working with people behind bars, and I have yet to meet anyone who I don't have hope for rehabilitation, for ability to function as a good neighbor, as a good citizen, as a good family member and neighbor. I think we all should have that opportunity. And it may be at that point in time that's not possible. But if we treat people the right way, I think it is possible. That's hope.
Can I just ask quickly, you talked about a fierce debate that was going on the floor. Can you just elaborate on that? I would really love to know what type of data or evidence-based information that this law is kind of founded on, because my understanding of it is the numbers are not good when we're talking about putting excessive sentencing terms on these drug-related issues. So can you just elaborate a little bit more on that?
Absolutely. So, selling drugs is currently illegal for those who are unaware, and under this law, it will continue to remain illegal. And the states that have these quote-unquote drug-induced homicide bills have not seen any decreases in the number of drug overdose deaths. In my testimony, I cited Hamilton County, Ohio, which really was fiercely prosecuting these drug-induced homicide cases. And in 2015, they prosecuted many of these cases, and then the next year they had more than 100 drug overdose deaths than they had had the year before, right? So there was no causation between implementing these policies and a decrease in drug overdose deaths. The over 50 minutes of debate that happened on the Senate floor, where 11 senators did vote no to this bill, cited many of the things that the people on this panel have also cited, that this would sweep up people who are selling to support their own habit, mostly poor people, mostly communities of color, and many of the senators who represent those communities, talked about the effect it would have on their constituents, right? People cited the fact that decades of punitive drug policies have not helped this problem, but probably have made this problem worse, right? And many people talked about how this law does not get at the drug kingpin, and many senators said, yes, we are willing to work with a bill that does get at that top level profiteer, drug kingpin, trafficker, producer, manufacturer, but this law does not do it, and it's too vague, and we don't want to work with it.
So then the debate on the floor is whether the intent is to use the law as a form of punishment, right, versus using the law as a form of getting kind of reducing overdose deaths, overdoses, as well as reduce use maybe in the community. Am I correct?
Correct, and people did cite that this does not appear to have any deterrent effect of people either using or selling drugs. And actually, one senator even cited that nations like Portugal, which have decriminalized the possession of drugs, have seen decreases in drug use, and that criminalization is not the answer.